Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee, with you. This get up. I know this get up since it's a festive season, so I thought it will be a best style. And I am doing this stream from a wedding place, so that's why we have to face this. So, without wasting any more time, I have to go somewhere else also. So, without wasting any more time, let's just jump into 30 seconds countdown time.
Good evening, sir.
Good
Good evening,
evening.
everybody on screen, and good evening, everybody on screen, and whoever is watching live today. And we are really proud to announce the days are counted for our Golden Jubilee anniversary celebrations to be held on 12th of December at the NIH Kolkata campus. And we are really proud to announce another thing, important thing. This CME is going to arrange on behalf of the Alumni Association to stream live the entire Alumni and Golden Jubilee celebration program on 12th, live from NIH campus stage. So, our request on behalf of President and the Executive Committee of National Staff Honorary Alumni Association, it's our request to come and join us. Those who are delegates, they will be getting all the mementos and whatever is there, the lunch, dinner, and everything. But the others can join. We cannot provide them with the mementos and all because registration is already closed. We request to all the delegates who had paid the delegate fees, if you are registered online in www.nhaa.in, please register yourself over there because we'll be starting sending you the QR from 1st of December. And there is another important announcement with the help and the inspiration from our beloved president, whom we see always on screen, our respected Dr. Narayan Kalyani sir. Uh, we are going to organize, with the help of our faculty members and also our alumni producers, blood donation camp on 11th of December in the NIH campus in the NIH Seminar Hall. Our target donors are about 200, which includes students, the members, staffs, alumni, and also outside homeopathic lovers. So it's a really great thing to announce, and we are grateful to our faculty members, especially Professor Dr. Abhijit Shi Barman, Sir Dr. Said Sir, and other new faculty members, Dr. Anirudhana, Dr. Shanti, who are looking after this program. With the permission of our President, Dr. Devnan Kalyani, sir, may I call on tonight's inaugurator, sir?
Sure, please call him. Please call.
Yes, sir. Let's proceed to call on our inaugurator tonight, Dr. Paira, a very successful practitioner, researcher, and he has been with us from seventh batch of BHMS course. Stage is all yours, Dr. Krishnendu. Welcome
Thank
to
you. Thank you,
On
Bidyut.
Screen on the 28th episode of CME.
Thank you, Bidyut. Good evening, all the members of our NIH family. This is Dr. Krishnendu Paira. I'm from 7th batch BHMS. Presently, I am serving as Chief Coordinator Research Project at Swami Vivekananda Center for Advanced Biomedical Research under Department of Biotechnology, Heritage Institute of Technology, Kolkata. It is my privilege and I consider myself fortunate to inaugurate the 28th online CME. And I'm thankful to the organizing committee, especially to our respected Devnaran Kalyani sir and our beloved Bidyut to opting me and for such responsibility. It's my honor that we have with us an eminent teacher and renowned physician, Dr. Byasdeb Ghosh, and he's from ninth batch of Deep NIH as moderator today. He is now attached as Associate Professor, Department of Materia Medica at Netai Charan Chakraborty Homeopathic Medical College and Hospital, Howrah. And today's speaker is Dr. Ankita Bhakat. She is from 25th batch BHMS and 23rd batch MD Homeopathy. She is now Assistant Professor, Department of Pharmacy, National Institute of Homeopathy, Narela, New Delhi. She will deliver a session entitled Unveiling the Role of Homeopathy in Infertility case series. She has a profound knowledge and vast exposure in this field. So, without wasting any time, I welcome Dr. Byasdeb Ghosh sir, today's moderator, to continue this session. And sir, the floor is yours. Please, sir.
An inspiring inaugural speech. Thank you so much for your contribution in the field of homeopathy. Good evening to all of you. Today I feeling very honored to have the opportunity to present myself as the moderator of 128 CME organized by NIH Alumni Association. It has always been a privilege to be an alumni of such a prestigious institution like NIH. Before coming straight to the scheduled discussion, I would like us to remember the contribution of Dr. D. Kalyani in keeping the previous CMS alive. He was an eminent ARO in NIH. I would also like to convey my regard to the organizer, some of my junior brothers, Dr. Pralay Sharma, the present functioning director of NIH, Dr. Bidyut Mukherjee, the secretary of Alumni Association of NIH. Their contribution is very valuable. They contributed their valuable time into making the CME a successful one. Our today's topic is unveiling the role of homeopathy in infertility, a case series. Presenting a series of real case can really be an answer to question like whether or not homeopathy is effective in the treatment of fertility. Now let's welcome our speaker of the evening, Dr. Ankita Bhakat, who will guide us in our journey towards unveiling the truth. Come on, Ankita. Ankita, please. Ankita Bhagat, come on, please. Hello.
Thank you, sir. Am I audible?
Yes, yes. Yes, please carry on.
Good evening, everyone. With heartfelt gratitude, I sincerely thank everyone for giving me this opportunity and platform to present my cases. I express my deep respect to Dr. Samuel Hahnemann, whose principles continue to inspire and guide us in the practice of homeopathy. I am proudly thankful to Dr. Proloy Sharma sir, Director NIH, for his encouragement. My sincere appreciation to Dr. Bidyut Mukherjee sir, General Secretary, NIH Alumni Association, for his continuous support and motivation. I extend my gratitude to Dr. Kalyani sir for his valuable guidance. I am also grateful to Dr. Byasdeb Ghosh sir for moderator today's 128th CME. Also, thank you to Dr. Krishnendu Paira sir for inaugurating the seminar. Uh, Lastly, special thanks to Dr. Orko Mukherjee, who is behind all the technical work. So now I am going to present. So as we know, what is infertility? Infertility is defined as a failure to conceive within 1 or more years of regular unprotected coitus, right? So primary infertility denotes those patient who have never conceived, and secondary infertility indicates previous pregnancy but failure to conceive subsequently. The epidemiology of infertility: 80% of couples conceive within 1 year with regular intercourse, that is 4 to 5 times per week, and 10% more conceive by the end of 2 years. Remaining 10% are considered infertile after 2 years. Infertility impacts approximately 186 million people worldwide. In the year 2021, the global age standardized prevalence rate for male infertility stood at 1354.76 per 1 lakh individuals. Conversely, for female infertility, the ASPR was recorded at 2764.62 per 1 lakh individual. From 1990 to 2021, there has been an increasing trend in infertility prevalence, with female facing infertility issues at nearly double the rate of male. In 2021, India held the top position among 2004 countries and territories for both genders' infertility prevalence cases. In 2021, the ASPR for female infertility varied between 308.22 and 5751.56 per 1 lakh individuals. In a similar fashion, the ASPR for male infertility ranged from 286.34 to 2804.1 per 1 lakh individuals. Now come to the common causes of female infertility. So tubal factors, which contributes 25 to 35%, post-infective damage, pelvic endometriosis. Then ovarian factors contributes 30 to 40%, anovulation, corpus luteum insufficiency. Then these ovulatory causes contributes 10%, ovulation disturbances, cervical factors 5%, infective sperm penetration, chronic cervicitis, immunological factors. Then uterine factors, unfavorable endometrium, endometritis. Most common causes are tuberculosis and fibroid, syncy, congenital anomalies, pelvic causes like endometriosis, adhesions. Common causes of male infertility: pre-testicular causes, endocrine factors are there, gonadotrophin deficiency, obesity, thyroid dysfunction, hyperprolactinemia, psychosexual like erectile dysfunction, impotence. Some drugs involvement are there, genetic Klinefelter syndrome, Y chromosome deletions, single gene mutations, Testicular causes like immotile cilia, like Carter-Jenner syndrome, and cryptorchidism, infections like mumps, which will cause orchitis, toxins, varicocele, Sertoli cell only syndrome, primary testicular failure, etc. Post-testicular causes are obstruction of efferent duct, congenital, absence of vas deferens, Young syndrome, then some acquired infections like tuberculosis, gonorrhea, and others are ejaculatory failure, retrograde ejaculation, hypospadias. So we have to investigate the case nicely. If any couple is coming for the first time in the clinic, like if they have not consulted before, then we must give investigation for the male. Okay, as the female investigation cost are high, so we have to means at first we will give test to the male partner. After that we can means next visit onwards, if there is no immotile function or anything, then we can give to the female partner. So let's see what are the female investigations are there. So general health history, we have to take the history first. General health history, then sexual history, family history, drug history, medical history, and menstrual history like oligomenorrhea, amenorrhea. Primary investigation, we have to give blood test. For general blood investigation, there is a total blood count, hemoglobin count, and a serological investigation like HIV, HBs, AG, VDRL, and hormonal investigation, which is very important. It is thyroid dysfunction test, T3, T4, TSH. AMH is very important. FSH, LH, serum prolactin, estrogen, and mid-luteal serum. Other investigations are ovarian reserve test, antral follicular count. In secondary investigation, cervical factor, uterine factor, tubal factor, ovarian factor, peritoneal factor, and ultrasonography, transvaginal scanning, hysterosalpingography, MRI, laparoscopy. Now come to the investigations for male infertility. Same, we have to take the history first. In general health history like BMI, smoking, any alcohol consumption is there or not, is the age, any stress factor is there or not, family history like birth defect, genetic mutations, medical history, and drug history, then sexual history, ejaculatory dysfunction, frequency of coitus, then physical examination and primary investigation. Same way, some blood test we have to give, like hemoglobin, CBC hemoglobin, genetic tests like karyotyping, hormonal assays, FSH, LH, testosterone, thyroid profile, semen analysis, which plays an important role, and varicocele is there or not. Okay. Then secondary investigation is sperm DNA fragmentation. Then post-ejaculatory urine analysis, testicular biopsies, if needed. Now come to the treatment part. So the conventional treatment I will discuss here. General measures like if someone is suffering from PCOD, any female, then weight control she has to do. Okay. Treat the anemia, thyroid disorders, diabetes, stress reduction, ovulation induction by some drugs, treatment for anatomical causes, tubal factor, uterine factor, that is septum corrections, myomectomy for submucous fibroids, then polypectomy, Treatment for cervical factors, they used to do and gives the antibiotics for cervicitis. Endometriosis related infertility, which is very common. I will discuss in my cases. You will see the cases of endometriosis. Endometriosis related infertility, there is laparoscopic ablations, excision of endometriotic lesion, ovarian endometrioma, cystectomy, controlled ovarian stimulation, IUI, then IVF in moderate severe cases, then assisted reproductive techniques like IUI, IVF, oocyte donation, surrogacy. Now, conventional treatments in males. General measures, weight reductions, stop smoking, alcohol intake, avoid heat exposure to testes, hot baths. Surgical treatment like varicocele repair, obstructive azoospermia, hydrocele correction, testicular biopsy. Medical treatment, some hormonal therapy according to the problem. Then assisted reproductive techniques are also there for male. So now come to my case number 1. So a 32-year-old female patient presented on 14th August 2024 with the complaint of being unable to conceive since 1 year of her 1 year and 6-month marriage. She was under modern medication and she had some previous reports which reveals that she has pelvic endometriosis and left adnexal complex cyst along with AMH level is 0.50 nanogram per ml. She was asymptomatic and having a regular menstrual cycle. Her past history reveals that she had gone through chicken pox in 2006, then 2015 PCOD, 2019 profuse leukorrhea, pelvic pelvic infection was there. In family history, in maternal side, her mother was suffering from postmenopausal symptoms, grandfather CVA, then her auntie diabetes mellitus type 2. This most probably aunt means Mashi. And paternal side, her uncle also has diabetes mellitus type 2. Cousin suffered from lung cancer and died. Her physical generals were thirst profuse, takes little at a time, thermal reaction chilly, desire sweet, salt, milk and milk product, decubitus knee chest position while sleeping, dreams chasing by someone, stool and urine was regular and clear, red moles present. Mental generals, anger was a little bit more and expressive to the near ones. Grief, childhood trauma of physical abusement by family members. She was fastidious, likes thunderstorm, like she showed. So analysis and evaluation of symptoms, mental, generals, abuse in childhood, fastidious, love seashore and thunderstorm. Physical general, thirst profuse, desire milk, salt, sweet. Sleep in knee chest position, dreams chasing by someone. Characteristic particular, nothing. She was asymptomatic, so I have taken unable to conceive. This was her complaint only. So the totality of symptoms I made: abused in childhood, fastidious, loves seashore, loves thunderstorm, thirst profuse, desire salt, milk, salt and sweet, sleep in knee chest position, dreams chasing by someone, unable to conceive. This is the repertorial analysis done from Radar version 10. Here you can see carcinosin has come in the carcinosin covers the out of 11 symptom, it covers 10 and degree is 13. So this is the progression of case. Initial visit, I gave carcinosin 200, 3 doses. Then she again came in 22nd September 2024. She got early menses on 21 days. Usually her menses was regular, 28 day cycle, but this time she got in on 21 days. I prescribed placebo again for 4 weeks. Then she came 7 October 2024 that she experiencing a missed period. Then I advised to do UPT and again give medicine, means placebo for 4 weeks. Then she 9th of October she conceived. Then I advised her to consult a gynecologist. So this is the result part report, T4 report. It is which is ultrasonography of lower abdomen. Impression left adnexal complex cyst, likely chocolate cyst, pelvic endometriosis, and her AMH level is very low, that is 0.50 nanogram per ml. This is the after result. After consulting with gynecologist, she sent me the report. That single viable pregnancy of about 9 weeks, 3 days gestation. So she already gave birth to the child. She gave birth to a baby boy actually. Okay, this is my case too. A 32-year-old female presented on with severe lower abdominal spasmodic pain during menses since 18 years of age, which is aggravated by exertion and reduced by warmth. Her menstrual history reveals that she has regular menses with normal flow and soreness in the nipple. Furthermore, she was unable to conceive for 2 years of her 3 years of marriage. She was under modern medication since long, and from the USG report, which revealed that she had multiple uterine fibroids and a cystic lesion in her right ovary, likely representing an endometriotic cyst. So this is her past history. 7 years of age, she has experienced obstinate constipation. Then measles in childhood. In 10 years of age, history of worm infestation. 12 years of age, jaundice. In 2015, extreme weight loss. 2018, knee fracture, right leg. 2021, white discharge from nipple. 2023, hemorrhoids. 2024, history of UTI. Then fatty liver, food poisoning, mumps. In her family history, mother suffered from gastric ulcer, aunt breast cancer, grandfather asthma, uncle pancreatic cancer, my paternal side, father diabetes mellitus type 1, hypertension, aunt diabetes mellitus type 2. Now come to the physical general part. Appetite. She cannot tolerate hunger, causes dyspepsia. Thirst 3 to 4 liter per day. Thermal reaction hot, heat sensation on both the palms. Desired sweet raw onion ice cream. Aversion sour. Intolerance milk. Stool regular, becomes hard if takes outside food. Urine clear, sweat profuse, more on face, decubitus left side. Red moles present in her case also. Mental general, desire to be alone, sympathetic, weeps easily, fear of darkness, claustrophobic, likes music, animal lover, likes seashore, likes thunderstorm, religious, and sensitive to noise. This is the analysis and evaluation of symptoms. That is in mental general. I have taken all the symptoms like sympathetic, fond of music, weep easily, and fear of darkness, claustrophobic, loves animals, desire to be alone, religious, like seashore, like thunderstorm, physical general, thirsty, thermal reaction hot, desire sweet, sleep position left side, characteristic particular painful menses, unable to conceive. Totality of symptoms: sympathetic, fond of music, weeps easily, fear of darkness, claustrophobic, loves animals, desire to be alone, religious, like seashore, like thunderstorm, thirsty, thermal reaction hot, desire sweet, sleep position left side, and painful menses, unable to conceive. This is the repertorial analysis. Here you can see again carcinosine came. I have considered this case as carcinosine. Okay, so this is the case progression. Little bit twist is there actually. So I prescribed carcinosine 1M by considering all these points and referring the materia medica also. SP the carcinosine picture I referred. I prescribed carcinosine 1M 1 dose and placebo for 1 month. Again next month she came. Then pain in abdomen. Her periods was regular. Every month she got period. So pain in abdomen better during menses. On 19th January 2025 she came again. Soreness in nipples better. I gave placebo for 2 months. Then again she came on 27th of March. Symptomatically better but unable to conceive. Then I thought already 3 months passed. Okay. So I prescribed that in Serenum 1M 1 dose by considering this point that worm infestation in childhood. Actually, you have seen in past history, I have taken the history that in 10 years of age, she experienced worm infestation, severe worm infestation she experienced. By considering this point, I have taken this. I referred here Clark's Materia Medica, Volume 2. Then Sydenham 1M 1 dose prescribed and placebo for 2 months. Okay, after 2-3 months, she came on 2nd June 2025. Again, her periods was on time. Then I have reconsidered the case because some new symptoms appeared. Okay, like drawing pain in the extremities during menses. Previously, only spasmodic pain was there in lower abdomen during menses. Now she is experiencing drawing pain in the extremities during menses. Previously, it was not there. Nipple soreness, previously it was there, but now started before 5-6 days of menses since last 2 periods after Sydenham. She is experiencing this, or I don't know why she is experiencing this. Stool hard for 15 days with tenesmus, unable to conceive, sexual desire this time increased, acidity, whenever she eats anything, acidity increased. She was experiencing it since 7 days. So I prescribed conium this time, conium 1M, 2 doses I prescribed, and placebo for 2 months. So next, in 8th August, she came again. Again, her menses came. She unable to conceive, failed to normal conception. But patient was symptomatically completely better. Pain extremities during menses much better in last menstrual cycle. Nipple soreness not occurred anymore. Stool passes regularly, semi-solid. No history of acidity. So again, considering this better uh, means considering this symptom, I prescribed placebo for 2 months. Okay, I want to see. Okay, let's see what happens. Then again, 30th October she came. That time she just uh, she got the means she came 8th of August 2025, and then after 2 days she got her last menstrual period means last menses on 10th August. Then she came to me 30th October that informing me that she has conceived. Okay. Then I told her to advise to continue consultation under gynecologist. So again, I repertorized the totality. Conium came. So this is the repertorial analysis of conium. And in Serenum, actually, Serenum in Clark's Materia Medica Volume 2, under Serenum, Serenum relationship, there you can see that conium is there, but not like they, it is written as compared this medicine. There, conium is the medicine. Okay. And in conium, in boric also, under conium relationship, selenum is there. So somehow I find correlation between them. So this is the result before. You can see uterine fibroid, cystic lesion in right adnexal ovary. Then fatty liver she developed. And this is our after report that early intrauterine single live embryo, 12 weeks duration and 6 days duration. So now come to case 3. So a 29-year-old female presented on 21st February 2025 with the complaint of painful profuse menstrual flow and being unable to conceive for 1 year. On further query, it has found that motion increases the flow and lower abdominal pain increases by slight exertion. Her menstrual cycle was regular. She was under modern medication and presented a USG under whole abdomen report of hepatic calcified granuloma, cholecystitis, and cholelithiasis, uterine seedling fibroid, bilateral polycystic ovaries, and right ovarian functional cyst. She has been advised to have a cholecystectomy and continue homeopathic treatment. I advised her go and do the cholecystectomy because on 21st February she told me consulted first with me, but she is suffering from that GB stone. She has been diagnosed since 2024. So I advised her that you go and do the cholecystectomy. In past history, here you can see the chickenpox until at the age of 12 years, 2021 COVID-19, 2024 lung infections and joint pain, 2024 July hospitalized due to abdominal pain, GB calculi detected. Family history, maternal mother has heart disease, grandfather and mother both hypertension, paternal history, father TB, grandfather also suffered from TB, sister obstructive uropathy. Okay. Physical gender, Appetite, she can't tolerate hunger, thirst less, thermal reaction hot. Desire for ghee and milk was very high. Intolerance sleepy vegetable and milk. During frequency increased during menses because frequency increased during menses. I thought of because she was having a profuse menstrual flow, right? So it create pressure on bladder most probably. That's why. And stool regular, passes semi-solid stool, sweat profuse, sleep disturbed, dreams of dead person. Uh, then mental generals, overthinking about health issues, weeping disposition, grief of death of grandmother few months back, and on her dreams, her grandmother comes. Anger increased since few months. Depression during lockdown, as we all have experienced depression during that time. Analysis and evaluation of symptoms, mental generals. I have taken weeping disposition. Physical general cannot tolerate hunger, desire milk, intolerance leafy vegetables and milk, dreams of dead person. I took right-sided affection by thinking of the hepatic granuloma, then the gallbladder calculi, then the these things, and thermal reaction hot, profuse perspiration. Characteristic particular, I took menses profuse. Totality of symptoms, weeping disposition, cannot tolerate hunger, desire milk, intolerance of leafy vegetables and milk, dreams of dead persons, right-sided affections, thermal reaction hot, profuse perspiration, menses profuse. So this is the repertorial analysis. Here you can see that calcaria came out of 9 symptoms. 22 means it covered, 22 degree it covered. Now let's see the case progression. So here initial visit, you can see that she was having a heavy menstrual flow, clotted consistency, and pain in lower abdomen during menses, and unable to conceive. So I prescribed calcarea iode, not calcarea carb, because thermal reaction was hot and patient cannot tolerate hunger. And I referred some of the materia medica, boric, pulford, materia medica. These things I Clark also. So after considering the materia medica, I prescribed calcarea iode. Uterine fibroid, it is written in boric materia medica under calcarea iode, uterine fibroid. Okay. So I prescribed calcarea iode in LM potency for 15 doses for 15 days, and advised her to consult surgeon for cholecystectomy. So she has done her cholecystectomy on dated 20th Feb 2025. She again came on 11th of March 2025. Her LMP was 12 February 2025. So that time, after calcarea iode, her pain lower abdomen during menses was better. Flew heavy for first day, then better. Consistency clotted remains same. Frequency of urine during menses reduced, and sleep was sound. That time I prescribed calcarea iode 0/2, 15 doses, again for once daily for 15 days. And she came 20th April 2025. That her last menstrual period was on 18th March 2025. And she missed her period. Missed period, and she has done the UPT. Okay, and it was positive. So I advised her that you do the blood for beta HCG. Then after one day, she told me that yes, she has conceived. Then I advised her to consult gynecologist. So this is the before report. Where here you can see that uterine hepatic calcified granuloma, cholecystitis with cholelithiasis, which she has experiencing, and I told her to remove it. And uterine seedling fibroid, bilateral polycystic ovary, and right ovarian functional cyst. So I took the rubric na, that right-sided affection by considering this point only, hepatic calcified granuloma and right ovarian functional cyst, right-sided affection. And result after you can see the her beta ECG titer report. It is saying that it's positive. And after that, she has done ultrasonography. Here you can also see that intrauterine single live embryo of approximately gestational age 7, 8, 6 days. So the case studies presented show that individualized homeopathic prescription based on thorough analysis of symptoms and patient histories lead to eventual conception in multiple cases for different patient who had previously failed to conceive despite conventional medical interventions. The series adds to the clinical evidence that individualized homeopathic management can positively influence fertility outcomes, but larger studies are warranted to further validate this result. Actually, homeopathy is a big relief for the couples suffering from infertility. It avoids painful procedures, reduces financial burden, provides natural conception, and removes the emotional blocks. Hence, it is a holistic treatment. Homeopathy offers cost effective treatment, offering natural conception at an affordable price. These are the references. Thank you. And thank you everyone for your patience listening. Thank you.
How exactly homeopathy works in infertility? The cases shown by you are the proof of the true essence of homeopathy, and it is your way to paying tribute to the pioneer, to the master Samuel Hahnemann. Thank you.
Thank you, sir.
Thank you all who are with us.
Many thanks, Dr. Byasdeb Ghosh. Many
Thank you.
thanks for coming with us and moderating the session. And Dr. Krishnendu Paira for inauguration. Beautiful. We are very happy that all of us are gradually joining this CME. Regarding Ankita Bhagat, fantastic presentation. This is his beginning. Just imagine when she'll be in our age, what will be his result? How many numbers of infertility will be cured by her? Many thanks. Your approach, exactly scientific homeopathy approach, animal approach is really appreciable. Carry on, madam. So I can give you some information regarding mother and infertility that many of you might be knowing. Before that, let me tell you, Ankita, you referred the case for operation, gallbladder operation. What we can do, maybe due to being scared that there may have some acute abdomen or some other things. But in homeopathic practice, you have seen in NIH, OPD, and IPD, we have cured number of lithiasis, cholelithiasis. There was one CME, and there is one publication too in the bulletin, NIH bulletin, that Cholelithiasis can be safely cured, not one or two, number of cases. Probably about nearing about 70 cases was presented. I cannot exactly remember the number of cases. Cholelithiasis, urolithiasis, and cellulithiasis. So what we could do this for this case, that we could wait for some time until the case is giving indication of emergency or immediate admission. Our conception is because the bile duct is very narrow, size of the stone is big, so it can never pass out. The science is that what we have observed, that even stone in the neck, which is called to be a threatening to obstructive jaundice and immediate operation, patient was admitted in the IPD, and after admission, we have observed that the gallbladder stone in the neck passed out automatically by homeopathy medicine, maybe by peristaltic movement or by other means. We have the documents. Plus, we have the documents that compacted gallbladder stone, packed up with the stone, can also be cured by homeopathic medicine. That records we are having in our OPD. So nothing to be worried about. If you find any cases of that, you ask the patient, I will observe. I will follow up the case every second or third month by USG. If the things comes down, size reduces or complex goes up, then we'll further wait for a few more months. If I find that things are increasing day by day, size, number, complaints, then I can think for surgery. Just to give you confidence that huge number of cases has been cured in NIH OPD in Salt Lake.
Okay.
Next. Probably you have forgotten to mention one thing. The cases you are treating for infertility. Definitely, the seedling or whatever size of fibroid is, uterine fibroid is, ovarian cyst, all the things have got automatically cured. With the pregnancy period, the things will come down and ultimately gynecologists will find a normal uterus. I'll give you one example of my case. That time, I was a student of third year. I didn't have the idea of homeopathy generality or totality. So one of my relatives, he was suffering from infertility. And one day he requested me that can you do something about 9 years of pregnancy, 9 years of marriage. Can you do by your homeopathy? Then I started thinking, and eventually I found there is one drug in Ellen's Medica, epihistorinum. You can see it, prepared from the uterine fiber. So I gave her the medicine, and eventually, before that I should tell the case. Case was, the patient was my relative, and he was cousin of a famous allopathic practitioner in central Calcutta, who was friend of Dr. C.S. Da, famous gynecologist, who is having gynecology books, obstetrics gynecology. And my relative had multiple fibers, and he was declared by C.S. Da that it is very difficult to have pregnancy, or if you have pregnancy, viable baby is rare. So you forget regarding your own pregnancy, think some other way. What happened by giving epihistorinum without knowing anything, any reasons of infertility, incidentally or accidentally, you can say, patient reported me that her menstruation has been stopped. Pregnancy period started. Immediately consulted by his relative to Dr. C.S. Da. He confirmed the diagnosis and under his treatment. I did not repeat. Once I told my teacher that, sir, I have gave this medicine and patient has become pregnant after long years of marriage. My teacher told, do not disturb the patient in any way, whatever may be the complaints. He may take allopathic medicines, but never prescribe any other homeopathy drug to disturb your case. I did it. What happened ultimately, patient started crossing trimesters. He was cesarean section operated. And when operation was done, at that time, frequent EVG was not a tradition. It was found not even a single uterine fibroid is in the uterus. Then the team of doctors who operated in Arjikar Medical College, they are astonished to know how so many fibroids dissolved and had a normal pregnancy, normal fetus. Then they told, sir, I took homeopathy medicine. Then doctors, gynecologists told, whatever medicine you have taken, medicine has saved you. No matter homeopathy or allopathy. It is a miracle we have never seen. So this is my first experience with
Sir got disconnected because of the incoming phone call. Anyway, it has been an excellent session and we are proud of our alumnus. We'll wait for Sir. Sir will be back soon.
Am I audible now?
Ankita, yes,
Am
sir,
I
you are
audible?
audible, sir.
So since then, I became confirmed that yes, infertility is not a difficult thing for us. And till date, I can tell you the huge number of cases of infertility of different varieties, means PCOD, uterine fibroids, and endometriosis, many other complaints. 100% homeopathy can cure it. Except one or two failures, I am so confident that infertility can be best treated by homeopathy, not only the infertility, but also the background cause of infertility can be completely cured. Even I have seen such that one mother was treated for infertility of 12 years of marriage. He got pregnancy. In a 2 year, after 2 years, she got another pregnancy with twin baby. So much fertility can come after giving homeopathic medicine. One more information to all of you, you might be knowing that Government of India in the early decades of this century decided in Delhi that to grow India, to reach India from developing to developed country, one greatest criteria is a reduction of fetal and mortality rate. That is one constraint. That was faced by modern medicine system. In Delhi, there was a joint meeting by all system of medicine, including allopathy, homeopathy, and other Ayurvedic, Unani. There they decided that there are some constraints in conventional system of medicine because there are drug hazards. There are some obvious surgical cases like fibroid, etc., etc. Here, homeopathy can be safely used without any hazards, without this. So, Government of India proposed and decided mother and child care campaign throughout India through Department of Ayush. And incidentally, I was taken the charge from NI to this awareness program, Mother and Child Health, all over India. 23rd state took active initiative in this Mother and Child Health. There also we found that number of cases are getting cured, infertility, and you'll be astonished to know that gynecologists, obstetricians, they are telling that yes, we are constrained, we are facing risk in homeopathy, we are seeing the cases are getting cured. So please come forward and help the entire humanity to save from the growing infertility rate, as Madam was telling. Day by day, the infertility is increasing. So in this situation, homeopathy is a great help. That means what I want to tell you, that not only we are claiming that homeopathy can cure infertility, Government of India, all these systems of the medicine, they are also supporting that yes, homeopathy is able to cure difficult or constant cases of mother and child, including infertility. So please, it is my request to all of you, all the practitioners, please be cheered up. Definitely must try to find out the cause to prove yourself that you have cured not only infertility but also the disease behind. But the treatment procedure should be much away from your diagnosis. As Madam showed us, simply concentrate on the uncommon peculiar symptom, evaluate repertories, select the drug, whether carcinosin or whatever, you will see the magic. So anyway, because everyone wants study from the government, peoples, and the systems, we also be cheered up that infertility cases we must strive to it and will get success. Not only that, this infertility treatment will give the mother a child, save a family, save or many families will be happy. Plus, that mother will be cured of some critical disease behind infertility. That mother will be cured of many other cropping up diseases which are yet to be detected or used to usually may come after 5-10 years. In the initial, very early stages, there is those conditions can also be cured by homeopathy. Unknowingly, patient knows nothing. Doctor may not be able to detect the early stages of the serious disease. But if we give our constitutional drug, including infertility, those diseases will be cured. That we have seen. You can experiment this as I have done it. When you are treating the cases, during investigation, you may find some incidental detections. You did not have the attention for diagnosis, but while you were having one USG, as Madam was telling, gallstone was found. Say, for example, pancreatic cyst was found. During the course of treatment of infertility, observe it, you will see after the mother gives pregnancy, completes pregnancy, give a delivery child, that pancreatic cyst has been dissolved. It is no more there. I have seen many cases. You observe it, you have these experiences that homeopathy do not cure only one disease of a person, cure all the diseases of a person, whatever disease it is, whether infertility or any other disease. So anyway, this way we should present our cases before our fraternity, our profession, to inspire all of us. Yes. If Ankita can cure 3-4 cases, if I can cure 3-4 cases, if we all together try, we can cure 3-4,000 cases. Only inspiration is necessary, confidence is necessary. These are token, as I was telling, that sample of cure. Ankita's cured shown 3 samples, means we have number of cases to many persons. So thank you all, on screen, out of screen. It's a fantastic seminar, and this seminar is meant for cheering up, gaining confidence by seeing cases are cured. One thing I heard from a teacher, repeatedly I used to tell it, that whatever study, whoever the teacher, whatever the institution, if you can see one case is getting cured by you or some other, be sure that you will get the inspiration to cure these type of cases throughout your life, because you have gained the confidence that yes, this case can be cured by homeopathy. If this drug or that drug or repertory or case taking, definitely there is curability. Only my trials and effort is necessary. So with this, thank you very much. We think all of you will meet on 12th reunion, grand reunion to our mother's lap, where we have grown. We have spent our valuable youth with our friends. Means brilliant, selected friends for 5-6 years. Thank you very much. Good night. Come and see. We'll see to 12. Bidyut, please. One more request to all of you, as I do usually, like Ankita, keep all the records for your cure in OPD and IPD, whatever it may be. One hemoglobin level is improving, keep the record. If we develop the attitude of keeping documents certified by others, I mean, the UHG report was not signed by us, was signed by one sonologist, then it is that certification. So that will give us much confidence. Maybe some network issue. Was there any question for today's CME?
And there is no question at all.
Okay.
But I highly eager to mention a case, but as I am not the speaker, so I control myself.
Why?
May I?
You are the moderator. Obviously, please come forward and present your case. Moderator means leader of the CME.
A patient came to me. She was married 12 years, but there was no issue. And at that time, when he came to me, her hemoglobin was 4.5 gram percent. She had high pressure, hypertension, and high diabetes. And due to anemia, she developed ascites. So I advised her, you take at least 4 units of blood, thereafter you start treatment. But she told, I am suffering this and this problem, and after taking blood, I may develop HIV or anything. So I am not willing to take any blood. Then I told her that due to that anemic, you may the victim of heart attack. At that time, all will blame to me. She told, no blaming. You start treatment. Then I start treatment, and within most probably 1 year, her hemoglobin became 10.5 gram percent. Her BP control, sugar control, and she conceived, and she admitted due to labor pain at PG hospital, but very unfortunately, the cord was rolled the baby, and the baby died in full term. Then she became almost mad. Then I asked her, wait for 6 months, thereafter again you will try, baby will come. And after 6 months, she conceived again and get a male baby. I mentioned to the point here is homeopathy not only not only treats the infertility, as well as associated with all the problem of the patient is also recovered. That is our beauty. and that baby will be better than other patty. It is we know regarding calcaria phos and other drugs. I don't take more time, but I can't control myself without explaining the case. And her relative was a gynecologist, and that gynecologist was famous for test tube baby, etc. So I can't control myself without mentioning the case.
Thank
And
you.
there
Thank
are
you.
another case also. But Ankita is very good. Ankita is very good. And your
Thank you,
case is
Byasdeb.
really educational.
Exactly.
Okay. Uh,
Thank you, Byasdeb. You have inspired me to tell one more case. Because we are having time today, let us gossip. One day in OPD, Professor A.C. was the attending physician, means visiting physicians in my cubicle. He was there, and one patient came with completely paper white mother with a child on her lap, about 1.5 years old. So by seeing the patient, Dr. S. Somresh Chandra De, SC De, he told him, how long you are suffering from this fair complexion? The lady is telling, sir, I am like this since my early life. The lady was one Muslim mother. He immediately tell us, do immediately hemoglobin and send him to gynecologist for termination of pregnancy. Just imagine a medicine specialist by seeing the patient dark ring around the eyes with completely paperweight complexion suspected and sending the patient to one first pathologist for routine blood test, then gynecologist for termination of pregnancy because she is pregnant again. See the beauty. He went to pathology, gave her blood, went to gynecology. Gynecologist at that time, Dr. S.C. Das was gynecologist. Fantastic person. He advised medical termination because severely anemic. Lower conjunctiva is completely pale. Tongue is white. And the mother is telling, since childhood I am like this. Blood report came, patient turned back, not to SCD, but to me. And he told, show the blood picture. It was 6.2 hemoglobin. And she came on the day when SCD was not available. She told me, sir, I talked to my husband. He is very much angry and beaten me because you have advised to terminate the pregnancy. I won't be able to do it. Then I asked him, you come in the next day when AC Das will come. She came, and by seeing her, by listening from me, objection from her family member, he became very much furious and started giving slang words regarding his husband. Nonsense, idiot, illiterate. তোমাকে মেরে ফেলবে তুমি যেভাবে বোঝা করো talk to your relatives to make him understand that you will die along with the child. The thing happened. She didn't turn back to us. After an year, suddenly one day I find that patient is on the same cubicle of mine, and incidentally, Dr. A.C. Diaz was that day in the cubicle. He was his memory was fantastic. Just by seeing the patient, he started shouting, what? This is your baby? On the lap one baby, and in the hand one child of about 3 years. Means that early child has grown 1 year more, and another child in the lap. Again, child, is your child? হ্যাঁ ডাক্তারবাবু, বাড়িতে কেউ শুনলো না। Then AC told, see where we are, where is practice of medicine, where is gynecology, and where is real truth. A mother with 6.2 hemoglobin is delivering childs almost every year or every alternate year. See the strength of the physiology and see the weakness of our literature. There are many things yet to be added in the literature. This was our history. And I am sure that because the patient continued homeopathy medicine. Oh, one more thing. Again, she was sent for blood test and blood report came 6.4. My conclusion is that it is homeopathy for which one mother with 6.2 or 4 can be pregnant, can carry a child up to normalcy, normal delivery by virtue of homeopathy medicine and personal vitality. Surprising case. Anyway, thank you all.
Really.
Fantastic. Anything add you can add? There is time. Probably Orko and Bidyut has become constrained by network. So both of them are out of home.
I can think that after conceive, we will treat the case throughout the pregnancy, but uh, under under the guidance of a gynecologist may be
Right.
associated with that, but medicine should be only homeopathic. Then the patient will better, baby will better. My wife who got hemoglobin 8.4 and I consulted with ডক্টর আমাদের ডক্টর আমাদের গাইনি পড়াতেন ওনার নামটা কি এম ঘোষ ডক্টর এম ঘোষ গাইনোকোলজিস্ট
M. Ghosh. M.
then
Ghosh.
then he advised take some iron tablet but I denied and sir told that you are very adamant anyhow then I disconnected with Dr. M. Ghosh and I made a card in Sishu Mangal Hospital and they also advised take iron tablet or iron tonic like that. Then without taking any iron tonic and iron tablet, she gradually and almost promptly within 1 or 2 months it was 10 gram percent following 12 gram percent like that. Then they told, their gynecologist told, I have never seen that so much improved by this iron therapy. But my missus did not disclose the matter because they will be angry or ill-treated, etc. But this is happened, and this is the practical case. So we have a lot, we can do lot if we consider the patient sincerely and constitutionally, and good case taking is necessary. Thereafter, constitutional medicine, in some cases, some peculiar or some injury history, etc., some mental trauma, etc., may be present. On considering that point, we can also improve the patient as well as baby. One patient came to me who attempted suicide during 3 months of pregnancy. Then her husband came to me with wife and I prescribed Netram salt 200. Thereafter she became okay and no attempt to suicide furthermore. Previously, before conceived, the baby before conceived, she also had the tendency to suicide, but suicidal tendency is over and she got a male baby and that baby is now servicing. He is engineer.
Right.
So homeopathic beauty is there, as you mentioned.
Exactly,
We
exactly.
have also
This is beauty of
seen
homeopathy.
in my practice. In my practice. So it
Many
is
times
my
we will be
request.
surprised.
Uh,
Many times we will be surprised to see the improvement.
oh, of course, really, surprise and miraculously improved.
Sure,
that
definitely.
that nobody will believe.
Hmm.
That nobody will believe. They may understand that these are story, not practical thing, but really happen.
But recently, the development we have observed that the effect of homeopathy has reached to many modern system of medicine peoples. I have seen one case in emergency card of SSKM hospital where it has been written continue homeopathy medicine. In SSKM emergency department outdoor card. So people are gradually becoming aware of homeopathic effect. It
So
is
I
now
think
our
our
responsibility.
CME. So I think
Probably that
our CME.
we should conclude it because time is over and Bidyut and his son is busy, I think. Okay.
Okay. Thank
So
you.
good night to all of
Thank
you.
you.
We'll see you on.
Thank
Oh,
you.
busy,
Thank you so much.
busy has
I'm
come.
in the train and can connect, get the connectivity regularly, but learned a lot from Kalyani sir, and there's certain things of medical science which we do not get in regular basis. But only the CME is the platform where the essence of specific cases are coming out, and that's the beauty of our science. And we are really proud of our alumnus who are so diligently and so elegantly they had presented the case. We are looking forward to learn more from Ankita in the coming days. Especially, I had requested her to give not so much an interesting subject to study upon, and if she can tell something for the students in the coming days for in its upcoming CME in 26, how to make the study of pharmacy very attractive. So this can be very good topics in the coming days, and we are proud of our seniors and the essence what Dr. Debnan Kalyani sir, he had shared his experience. Also, our beloved Dr. Byasdeb, he had also shared his clinical expertise. And with this, I'm returning to the backstage editor to conclude the session and see you all. Before leaving, I want to make another announcement. Tomorrow for the North India alumnus, especially those who are staying in Delhi, I will be meeting you all at NIH Satellite Campus at Narela. So let's come and discuss how we can make a stronger networking in our alumni association. And we look forward to meet you all tomorrow at Narela campus. And before that, we will conclude our will be after the alumni meet. So let's keep our fingers crossed. On 12th of December, those who are planning a day ahead, or 11th morning, you will be added up the blood donation camp at NIH camp. Students, feel
You can
over
connect
to
your
you, Dr. Mukherjee.
Thank you all. Thanks for watching. If you have enjoyed the CMA, do make sure to subscribe. And to the YouTube people, means the headquarter one, please don't copyright this since I am in a function wedding program. So pardon me. So with this, if you have to the all the people who are watching on Facebook, YouTube, please do make sure to our counter channels like we have each other. All the links are given in description below. Just do make sure to get to that, and also don't worry. See you in our next CME. Until then, it's me or Mukherjee with you. Bye for now. And also, if you want to just get an auto e-participation certificate, the link is in the description. And for the Facebook people, it's on the caption. Do make sure to take the e-participation certificate. It will be on till 11:59. After that, the e-participation certificate will be closed. So with this, thank you all. Thanks for watching. See you in our next year. Until then, it's me or Mukherjee. Good night.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.